Okay, so how to do the nerve scans, okay? Basically, when, go back to the front desk screen. First thing is we want to make sure we have the patient's file up, okay, in Platinum. And we're going to come right over here to the electronic health record, which is the little adjustment button. And this will bring up the electronic health record where we can do this nerve scan. This is where we do the nerve scans right in through here. Right now this says full spine. If I hit that, it says cervical. We only use cervical. Now, cervical means neck. The reason we don't use full spine is because that means that computer is going to be scanning from here to here. And we don't gown people, so we're just going to do their problem areas, okay? If they have a neck issue, we're going to scan their neck. If they have a lower back issue, we're going to scan their lower back. If they have a neck and a lower back issue, we're going to scan both of them. But we're always going to have this on cervical because the computer tracks a smaller area of the spine, okay? So how we do this, we'll hit cervical. The next button we hit is we'll hit this scan button. So when we hit that scan button, you should see this picture come up, and then this says initiating, and then as soon as this says scanning, now we're ready to scan, okay? Now how this works, come up here, Helena, go ahead and face this direction. We can't do this through clothes. It has to be on the skin, okay? Now we don't want necklaces. If the necklace is a choker and we can't get it out of the way, as this runs over the top, that will give an abnormal reading, so we have to take it off. This is big, so we can bring this down. And in the neck area, we're going to start right here. Now, we do not want these probes pushed up against the skin. We want them the same distance. We don't want one like this. Because what this is doing is measuring skin temperature. So it's measuring skin temperature and it's comparing it from side to side as we roll up. If your nerve system is functioning properly, the difference in skin temperature should be very, very small. If your nerve system, from a subluxation, if you're pinching down on a nerve, that would cause the blood vessels on one side of the body to be bigger and the other ones on the other side to be smaller, which means we'd have less heat on the skin. So it's measuring skin temperature, but indirectly that measures how well the nerve system is functioning, because they should be pretty similar, okay? So we don't want it one pressed against and one away like this. We want these, we don't want them both pressed on the skin. Basically, if this outside edge, you can tell it's got it at an angle. If we just have the outside edge barely touching the skin, that's kind of a good rule of thumb. But we get down here, the lowest area we can in the neck, push down on the trigger, and then we're gonna slowly go up the spine and follow in the contour of that. Once we get up to the hair, we want to do a hair sweep to get the hair out of the way. And we'll keep going until we get right here to the base of the skull, and then we let go of the button. And as you can see, that will bring up her scan. Okay? For the lower back, if we were going to do that, again, we're going to keep it at cervical. We're going to hit scan, and we just want to come right down to the base of the tailbone. It's the same thing. Press the button, slowly go up, and then let go of the button, and then we're going to get our scan. Now, after that, since we did a cervical and a lumbar, we need to let the doctor know, well, which one is which, okay? So what we'd have to do is we'd escape out of here. We'd come up into here. We'd go into imaging. That brings up all of the x-rays. Now this is going to be a new patient, so the only thing that's going to be in there is going to be your scans. So it's just going to be the scans, and what you're going to do is you're going to go onto a scan, you're going to right-click it, and you're going to come down to rename, and if it was the cervical, you'll type in cervical and hit OK. You'll go into the next one, right-click it, hit rename, and that's the lumbar, and you'll type in lumbar, and then hit OK. And now when the doctor goes back and he brings up those scans when he's meeting with the patient, basically he'll know what scan he's looking at. Was it the cervical or the lumbar? So we have to make sure that we do that. We don't want to get into explaining this stuff. These patients have already watched the subluxation video. So a lot of times they'll already understand a little, and if they see these big hot and cold swings when they turn around, they'll say things like, "Oh my gosh, that's not good." That's not, and you know, the most we want you to say is, "Yeah, that doesn't look great," but you know, Dr. Thompson will talk to you about that. We don't want to get into explaining a lot of stuff, things of that nature. Okay. Okay. I think that's about it.
Okay.
That's how you do a nerve scan.